New infections are accelerating around the world in what appears to be the pandemic's next wave. But even as death rates remain lower in hotspots, health officials say it's too soon to assume mortality rates won't tick up alongside case counts.
The fall-winter surge continues to unfold in Europe with exponential increases in daily cases and matching percentage increases in daily deaths. The evolving epidemiological situation in Europe raises great concern.
As they look at the surging numbers, one expression is uniting many scientists. They're calling this time a cliffhanger moment. What can the figures tell us about the best way to respond? Welcome to DW's COVID-19 special. I'm Janelle Dumalaon. We find ourselves in a time where each day seems to bring new, sobering infection records. Governments everywhere are trying to push those numbers down while trying to stave off full lockdowns. But few have been able to avoid new restrictions. We bring you this report from France.
Merci, bonne journée.
Lunchtime in the era of coronavirus. The last time Emma Fenn had fries, she shared them with a friend who later tested positive for COVID-19. Emma then went to a temporary testing center close to a university here in Cergy, not far from Paris. But she never received her results.
It was annoying because all of my friends were meeting at apartments or anything to just live, and I couldn't even go to school to attend the class physically when I could. So it was really boring to just stay home and do nothing. But I think you have to go through that.
It's not usual for test results to get lost in France, but waiting for them isn't unusual. Recently, people here often had to sit tight for several days, in some cases over a week, to get an appointment and the result. Time during which many others could have been infected. France was hit especially hard in the spring at the beginning of the COVID-19 pandemic. That's why the country ramped up tests and is now carrying out more than 1 million per week, like in this lab led by Jean-Jacques Jiménez. He says the situation has improved.
Given
the fact that the requests were twice as high, we had to make sure that we could technically carry out the number of tests requested. Today, this situation is currently being resolved. But rapid testing is not the only solution. Cases are especially high in big cities like Paris, where the density of population is very high. This hospital in Pontoise, north of Paris, was going through a hard time during the first wave. Edouard Devaux is coordinating the COVID-19 response here. He sees another main reason for the rise in numbers in France. The French population suffered a huge trauma during the first wave. Nevertheless, with another wave, we're seeing a relative lax behavior in people. Devaux says personal responsibility is key in fighting the virus, keeping a safe distance and meeting as few people as possible. But since the virus is now heavily circulating in France, the government is toughening rules. In Paris, for example, bars have to close down for now.
We're joined now by Katarina Fenn. She's a lead data scientist at the World Data Lab. Katarina, since the start of the pandemic, we've been inundated with numbers, and it can be hard to derive meaning from them. We've seen the death toll from coronavirus worldwide past 1 million. Now, what does a figure like that tell us?
Well, first of all, I think it tells us that we should really take this challenge or this disease seriously. I mean, 1 million is quite a high number, and I think that a few months ago, we would not really have been able to imagine this. But to really derive meaning from the numbers and to really use them for setting measures, I think it's even more important to look at country-specific numbers, and especially country-specific numbers of deaths. And I think still always all these numbers, this pandemic really puts us into a new situation and into a really new challenge. And still we don't really know how the next months will turn out.
But why is it most important to get country-specific numbers and especially of deaths? How does that help us get the most accurate picture of the impact of the pandemic?
So first of all, I think if we look at the number of infections versus the number of deaths, the numbers of infections obviously depend a lot on how much do we retest. And the numbers of deaths, I think they are better reported in almost every country of the world. So I think they give us a better picture of what is actually happening and how bad the situation really is. I think, however, it can make sense to look at the number of infections if we think about short-term measures that we want to take. I think then the number of infections gives us a better picture. But otherwise, and especially if we want to compare different countries across the world, I think the number of deaths gives us an even better picture.
Now, comparisons have also figured quite prominently. People would say compare flu deaths to coronavirus deaths as a way of putting these numbers into context. How useful do you think that is as an exercise?
Well, I think if we compare the numbers of deaths, this can also actually be quite misleading if we compare COVID-19 to the normal flu. I think that in a lot of countries, we can see that the numbers of deaths from COVID-19 are not so high so far, like for example in Germany or Austria, where we had the chance to really take measures quite early in this pandemic. But I think here we should not be misled by the numbers of deaths, but we should rather look at studies that analyze the infection fatality rate. So this is basically the rate of how many people who are infected, no matter whether they show symptoms or not, really die of this disease. And here we can see that COVID-19 is actually 16 times as deadly as the normal flu. So I think that's the better comparison here.
16 times as deadly as the normal flu. That is a staggering figure, of course. I also wanted to ask you about the number of unreported cases. We have to assume there are a lot. How much do you think they affect our understanding of the whole picture?
Well, they definitely affect our understanding of this picture, and it's really hard to assess also how many unreported cases there are, especially in countries that either do not really want to test a lot, or also in poor countries that just don't have the possibility to really get good measures of these numbers. I think in this case it can be helpful to look at the total numbers of deaths, not only from COVID, but overall and in the whole country, and then compare these numbers to the averages from the last years. And I think this can really tell us, has the number of deaths increased? Have people been dying because of this pandemic?
Now, I have to say, Katarina, I worry that we lose sight of the fact that behind these numbers, there are real people and real consequences for real lives. To your mind, are policymakers doing a good job of remembering this when they design responses to the crisis?
Well, I want to assume that they are doing their best. And I think that in many countries, also, for example, Germany and Austria, they have done quite a good job so far. I mean, I think it's really hard to assess which measures we should take, and I really would not want to be in their place. So I think in many countries, they are doing a rather good job so far. Also, I think that the numbers are probably the most useful tool for setting measures and for strategic planning. So I think numbers and data really give us the best guideline here. And I think that as opposed to like emotions or the feelings that we have with this pandemic, numbers can also really help us to fight the misinformation and also the insecurity that is related to this pandemic. So I think that looking at the numbers and really trying to do our best with setting different measures here is the best we can do at the moment.
Numbers tell a story, but you have to be listening. Thank you very much, Katarina Fenn of the World Data Lab. We really appreciate your insights.
Thank you for having me.
And speaking of numbers, here are the latest data from more than 200 countries.
The numbers show new cases doubling in 38 nations and increasing in another 79 countries. They've stayed at the same level in 10 countries. 67 nations have seen their new positive COVID-19 cases decline. Another 8 are down by at least half. And 8 countries have reported no new cases for 4 weeks in a row. Here's the bar graph showing the statistics of the past few weeks. The fight against the coronavirus will be over when that whole chart turns blue. So it's going to take some time.
And now it's time for your questions. Over to our science correspondent, Derek Williams.
What's dangerous is the pneumonia. Why not find a cure or treatment for the pneumonia instead of the virus?
Pneumonia is a blanket term that's generally defined as a more or less serious inflammation of tissue in your air passages and or your lungs. It can be caused by a number of different pathogens, both viral and bacterial. The pneumonia that COVID-19 can cause is generally initiated by the virus and can't be treated, for example, with antibiotics, which only kill bacteria. When they're infected with SARS-CoV-2, the cells in the small sacs in your lungs where gas exchange occurs, what are called the alveoli, begin to die and clog the lungs up. And that can eventually lead to what's called acute respiratory distress syndrome. As the pneumonia progresses, the situation can be exacerbated by the immune system, causing massive inflammation, which is supposed to help get the infection under control, but which can actually make things worse. So treating or curing coronavirus pneumonia means either addressing the problem at its root, which is the SARS-CoV-2 infection itself, or somehow toning down the body's immune response to it when it goes over the top.